Welcome back everybody. In this video we are going to analyze the testosterone replacement therapy. What is testosterone replacement therapy? Well, TRT is what your doctor prescribe you or should prescribe you if you have low testosterone. And symptoms of low testosterone are brain fog, loss of libido, erectile dysfunction, depression, osteoporosis, sarcopenia, so loss of muscle mass, fat gain, and a lot of other stuff. Even depression can be so bad that low testosterone can make you to think about suicide. It's very harsh. So, if you have low testosterone, and usually the doctor force you to have a blood test to see how much testosterone you have. If he or she sees that you have low testosterone, he or she can prescribe you this therapy. But what is the problem? This problem is today the average, the reference range for testosterone in 240 till 850 ng per dl of blood. But I mean, there are little differences between countries. But this is the first problem, because today this is the reference range, but in the past it was 1500 ng per dl of blood. It was like almost double, no? The high upper limit of today is like the average levels of ones back in the time, but not much back in the time now. Just like 10 years ago. Yeah? In the past, like in the 1960s, the average level of testosterone were even higher. So this is a problem, because what the doctor take today for the reference range is just the average levels of today people, but today people are sick. We have a great decline in testosterone from the previous years now. I mean, in the past people have way higher testosterone. So taking this range as the average range or healthy range is stupid. We see that testosterone was way higher in the past, so this is a problem, no? And a lot of doctors, if you have like 300 ng per dl of testosterone, total testosterone, they are like, well, you're fine, you're in the range, I will not cure. It do not give a fuck if you have all of the low symptoms, you're depressed and you feel like shit. No, they are like, you're in range, so fuck you. So this is a first problem. And a good doctor should treat you about because of your symptom, not of your range in the blood, for many different reasons. One, as we've just seen, is the range are stupid. Second, is because of something that is the testosterone resistance syndrome. So the sensibility to testosterone is very different from a person to another one, because with the blood test you just see how much testosterone you have in the blood, in the serum, but that's not the real testosterone that have action on your body. Testosterone has action in your body inside the cells. Now, you need a receptor on the cell that takes testosterone inside the cell, then the testosterone goes to the nucleus and so forth and so on. By the way, different people can have a great difference in the sensibility to testosterone. So the range are even more useless. Now, a person should be treated because of the symptoms. So, let's just say that you should be treated if you have a low testosterone symptom, no matter the range. But what caused the decline in our time? Well, a thing is, I mean, we don't know for sure what is the cause. Now, it can be environment toxins, pollution, pesticides in the food, and stuff like that. It can be many causes, but we know that in the last 50 years we have lost 50% of testosterone. No? The average levels of testosterone are 50% lower. So nowadays people are half the men they used to be. No? People are far more feminine because of this reason, and they're weak-minded especially for this reason. So we don't know for sure what is the decline, the cause of the decline, but Probably it's just the pollution, toxins, and pesticides. Let's go to the protocol. Assuming that your testosterone, your medicine is going to prescribe you testosterone replacement therapy. What are, in my opinion, the best therapies, the best protocols? Now, I'm not a medician, this is not a medical advice, this is for entertainment purpose only. No, this is just what I should take if I have a lot of symptoms. The two best methods, in my opinion, are injection and cream. Injections are the traditional way now. In my opinion, you should take from 200 to 300 mg of testosterone per week. Testosterone intake, now we are speaking like testosterone intake. A common protocol is 200 to 300 mg of testosterone intake per week. Now, if you take testosterone propionate, for example, you can take less of that because that's an example. If you take 200 mg of testosterone enanthate, you will have 150 mg of testosterone. The other 50 mg are composed by the enanthate ester. The ester are just the molecules attached to testosterone to make it last longer in the blood. No, it's just like a prolonged released in the blood, just that, you know. And testosterone enanthate has a half-life of 5 days. This means that after 5 days, the levels of your blood will be the 50% or your initial dose. If you take 100 mg of testosterone, after 5 days, you will have just 100. If you take 100 mg of testosterone, after 5 days, you will have just 50 mg of testosterone left in your system. Another good protocol is the testosterone cream, not the gel, but cream. Usually cream is like 20% testosterone cream, 200 mg per gram of cream. In a common therapy is 2 click km and 2 click pn. Applied on the scrotum, because scrotum has a thin skin and a lot of blood vessels, and the absorbing is very good in that part of the body. And that seems like also for libido stuff. Now, no, there are some people that say, no, you're a pussy, just do injection like a mere man. That's stupid, okay? Most people have no problem to have a stupid injection, like you can inject all the time, but that's not the best way, you know? It does not give you the best, how to say, tapered level in blood, you know? Cream is a better opinion. You don't need to like tear your muscle, because in the long term that can create scar tissue. That's not good. By the way, one thing that we should focus on is that you should maintain stable blood level of testosterone, because if you have like a roller coaster of hormones, that gives you bad reaction, bad side effects like anxiety, acne, and a lot of stuff. So the best thing is to take as frequently as possible. Even if you have a testosterone enanthate that has an half-life of 5 days, taking that every day is the best option, because that gives you the most stable blood levels. By the way, you can just try different stuff, even inject that 2 times a week can be good enough. And now there is another problem, no? Because especially in Europe, medicines used to prescribe like 1 shot of 250 mg of testosterone once per month. No? A drug that has an half-life of 5 days once per month. This is absolutely idiotic. And people on testosterone replacement therapy in Europe that are using this type of protocol are fucked. I mean, they will have a terrible life and they will never feel good. Never. And this is very bad, because this can seriously damage the quality of life of people. Think about having all these symptoms for a lot of years now. No libido, you are not able to have sex with your partner or someone else. You have no energy, you feel like shit, you have all kind of side effects, because like loss of muscle and gaining fat make you also more resistant to insulin, so that low testosterone can make you diabetic. That's in a lot of other problems, especially also hair problem. Having healthy testosterone levels is very healthy for the health. Now, let's go for a little bit speaking about estrogens now. Estrogen are created by the aromatization of testosterone. Aromatization when testosterone, through thank you an enzyme called aromatase, is converted to earth estrogens, is transformed to estrogen. Now, estrogen are the main female sexual hormones, so people are terrified by estrogen and they think they make you a woman, but it's not really true. Estrogens are very healthy for bone density, for libido, for genitalia sensitivity and a lot of other stuff. So you have to have estrogens now, and people taking aromatase inhibitor maintaining their estrogen too low are doing like a very stupid thing, because they will have low estrogen symptoms. Now, we have this that is the reference range, no? From 20 to 40, I don't remember the limit of measurement, but you understood. And that's the extent same of testosterone. No? This range has no sense, because it's derived from one study when researchers noted that the obese people, now this study was done on taking into consideration of obese people, that I was saying obese people with estrogen in this range had a lower mortality rate. But that, I mean, who cares? They were sick people, very unhealthy. Why we should take into consideration this range for healthy people? That, in my opinion, has no usefulness. No? I personally should not take any aromatase inhibitor. It will let my estrogen rise in the same ratio as my testosterone go high, because having too much testosterone and too low estrogen will give you a lot of side effects, especially on the cardiovascular system, because your lipid profiles will be screwed and a lot of stuff, and also your libido will suffer. It's very common for people taking anastrozole or stuff like that to have sexual side effects. But now, let's go to the problems of today's medicine and society. Now, we just say that medication are taking into consideration and a stupid range are prescribing aromatase inhibitor because, like, a study on unhealthy people, preventing people to enjoy the benefits of having a good level of estrogen, especially in sex. Now, so these are the problems. Another problem is that people usually don't take testosterone frequently enough. Now, in Europe, this is like complete dystopia, especially in countries like Italy. They give you like one injection per month of a drug with an half-life of 5 days. But even if taking testosterone enanthate once per week is too little. No, you should take more frequently, liter dosage, more frequently. Another problem is they don't prescribe you enough testosterone, because they just want to maintain in this stupid range. Now, and they don't really care if you feel good or not. They're like, oh, you're in your range, so it's fine, it's not my problem. And this is a big problem in the modern medicine. They don't want you to perform at your best and feel the best. They just want to maintain you in the average range, you know? And that's very bad. In my opinion, Western medicine, and maybe also the medicine in every world, should focus on make people as healthy as possible and as like performing as possible, giving them the best quality of life possible, not just taking them in an average range. No? And especially for this problem, medicine usually never prescribe testosterone replacement therapy. They prefer to cure symptoms instead of prevent symptoms. For example, if you have depression, take these antidepressants. If you have problem to sleep, take these sleeping pills, and so forth and so on. And this is no sense. Why medicine should focus on just solve the symptom instead of prevent symptoms? Why just put some fix on a problem instead of prevent a problem to happen in the first place? In science, testosterone replacement therapy is extremely, I like the English word, extremely efficient in cure the disease, is extremely cheap and extremely safe because it has very little side effects. There are a lot of studies about that now. So cheap, very useful, and very safe, and that can help to make people healthier, and prevent problems to happen in the first place. Instead, usually, medicine do not care, and testosterone replacement therapy is a taboo, is still a taboo nowadays. For what reason? I don't know. I mean, some people say that big pharma just want to make more money with antidepressant and stuff instead of curing people with a very cheap therapy, because testosterone is extremely cheap, and even if you take the most expensive testosterone in the world, you will have to pay like $12 a week or something like that, okay? And that is super expensive in comparison to the production cost. You can afford, for example, testosterone to the black market for like $2 a week. I mean, it's stupid. By the way, another problem is that when medicine try to do everything not to prescribe testosterone, they, for example, prescribe the contraceptive pill to even young girls. In some contraceptive pills are very unhealthy. For example, the old type of contraceptive pills were made just by a derivative of progesterone, and progesterone like suppress all of your endogenous production, and you will see, and there are still medicians who prescribe that type of pills, and you see like even 15 years old girl with no estrogen at all, because all of their estrogen are suppressed by progesterone. And since estrogen is extremely healthy, not for the men, but especially in women, you see this little girl with all kind of side effects like no libido and osteoporosis and that, because they prescribe with no problem this kind of stuff. Instead, the modern pills are made by both a derivative of progesterone and a derivative of estrogen. It's just estrogen replacement therapy together with contraceptive therapy. So that's another story. Another thing is with women go to menopause, when they stop to be fertile, and the medicine usually easy prescribe estrogens to those old women. And if you ask them, for example, on forums on the web, through those medications, why you prescribe estrogen so easily to women and not testosterone to men, and they're like, well, but when a woman goes to menopause, there is a fast crash, they should be treated instead. For men is different, it's a slow decline, so they can endure that. What? It's like, what the fuck? I mean, why a man should endure for 40 years low-T symptoms that are just getting worse and worse and worse? Come on, I mean, poor man is like sexist for real. In science, some of these symptoms are really terrible. Not only like sexual dysfunction, because I mean, if you can't have sex, you will have a sad life and you will lose forever all your time, because if you just waste years of your life without getting laid, those years are lost forever, and you will just lose your life, But also because of depression. If you just have depression because of low testosterone, you risk to kill yourself with suicide because of death, when depression can be easily cured by testosterone, if low testosterone is the problem. So testosterone is like the best antidepressant in the world. By the way, these are like the modern problems. Too little dosage, not enough injection, application, and using an aromatase inhibitor. So inject as frequent as possible, or put the cream as frequent as possible. Take a good dose, and don't take in the reference range, take the dosage that makes you feel the best. So with no regard to the range, even because every person has a different sensitivity. Besides that, find a good medication. There are Facebook groups and forums on the web when people suggest good medication that are really good about this and don't do the stupid errors I explained. And if you're lucky enough to find this name, if you're lucky enough to live near this medication, you can go through them. You just need do a little research on the web. Unluckily, I live in Italy, and for Italians there is no such thing on the web. I'm looking for that, but there is no medication who speak about this clearly or explain its protocol, so you can go to a medication without wasting time with the knowledge that he will be good, and it will be good for you. By the way, this is my rant. See you next time, and do a blood test to see what your testosterone level are, or if you have low testosterone symptom, please call yourself. Your life will be awesome with testosterone. See you next time.